Atrial fibrillation, also known as A-Fib, is a chaotic, unorganized rhythm in which the top two chambers of your heart are not beating in conjunction with the bottom two chambers or the larger chambers of your heart. There are a number of causes of atrial fibrillation. Almost any particular heart problem can cause atrial fibrillation, most commonly heart valve disorders or coronary artery disease. All of these things can contribute to you developing atrial fib. However, the biggest risk factor for developing atrial fibrillation is age. But if you have high blood pressure or diabetes, or if you've had a recent surgery or pneumonia, you're at a higher risk of your heart going out of rhythm. To add to that, most recently, now we're even finding people in their 30s are getting atrial fibrillation, predominantly because they have obstructive sleep apnea. When people are sleeping, they stop breathing, it builds up pressure in the heart, and this is shown to be the largest emerging risk factor for atrial fib. For most patients, they develop some type of symptoms. It may be, I feel my heart racing, or I feel an irregular heartbeat, palpitations, shortness of breath, or some people just feel fatigued or tiredness. Worse than that, some people even faint and feel really dizzy when they develop atrial fibrillation. A-Fib can lead to a whole host of terrible problems, most importantly, death. Not only that, heart failure, stroke, and even just fatigue. This happens, again, because your heart is not in a regular rhythm. The top chambers should forcibly push blood down to your larger chambers. When they're not in conjunction, the blood cells get together and form a clot that can go to your brain, causing a stroke, or to a limb, causing an embolic event. Atrial fibrillation can be treated and even cured if it's detected early enough. Here at Bryan, we have highly skilled physicians, electrophysiologists, that have access to world-class technology. We use it to both treat and diagnose heart rhythm disorders. If you have symptoms of atrial fibrillation, we have an atrial fibrillation screening clinic, and you can come in for just $10. It's painless, it's non-invasive, and it'll help you detect if you have atrial fibrillation or an irregular heartbeat. If you want to know more about atrial fib, you can talk to your primary doctor, or you can call Bryan Heart at 402-483-3346. Just ask for an A-Fib specialist. Or if you want more information, you can go online. Go to bryanhealth.org/A-Fib. And finally, if you want information in person, I'm giving an upcoming community program. I'll be talking more in depth about A-Fib and what you can do. Please join me Tuesday, February 9th at 6:30 p.m. at Bryan East Campus. Thank you for your time and learning how you can keep your heart healthy.